So thank you, Mariana, Steven, Dan, for joining me. And thank you to everybody in the audience, to all of you for your questions. Thank you in advance. Before we begin, I want to take a moment to congratulate everyone from MIT who was involved in the Perseverance rover landing on Mars earlier today. And now on to our Q&A with our great speakers from tonight. I'm going to ask a couple of questions to start the discussion, and then we will field questions from the audience. To submit your questions, please use the Q&A button that you'll see at the bottom of the screen. So to Dan, Mariana, and Steven, we're all MIT graduates, so I thought I'd ask each of you to reflect on something related to that. What surprised you when you first arrived on campus? What was different from what you expected of MIT? And I'm going to start. I'm not normally going to answer questions. When I showed up in 1975, MIT had a reputation of being a cold, hyper-aggressive, unfriendly place filled with people with no social skills. And I'm sure you all know the joke from that days. How do you tell a really friendly MIT student? He looks at your shoes, not his shoes, when he talks to you, and you all laugh because you think it's funny. And I discovered that was completely wrong. People at MIT were friendly, curious about what you were doing, collaborative, really wanted to interact with people. And that's still true today. And I think that's one of the things I loved about MIT when I arrived. Dan, I'm sorry, we're going to do this generationally. So you're the next one to arrive at MIT. What surprised you most?
I think what surprised me most, and as you know, it was many decades ago, showing up at what was then the AI lab, was the really amazing problem-solving orientation of the faculty, of the students, of the researchers. It was a big shift from my undergraduate education. People really just wanted to dive in and solve the problems that were at hand, and we're standing around brainstorming at the whiteboards. And maybe I'll offer another comment beyond what you asked, which is I just came back to MIT about 1.5 years ago after 3 decades away. And once again, I was really surprised by the problem-solving orientation on the MIT campus. So, you learn the same lessons over and over again, but it is a really incredible thing about the MIT community.
Thanks, Dan. That's great. Mariana, what surprised you most when you arrived?
My answer is actually very related to Dan's answer. For me, I think it was the optimism. I felt like if all of these incredibly brilliant people have these really deep understandings of huge, daunting problems, they're going to be despairing. And it was quite the opposite. I was really overjoyed to see that the deep understanding of the problems was leading towards a solution-oriented posture of, we can do something about this, no matter how big the problem. So the optimism was what struck me when I first got to MIT.
If I can, Mariana, that sounds so much like what President Reif says, right? That challenges to everybody else at MIT are opportunities to just dive in and tackle them. And I love that expression about the optimism. Steven, what surprised you most when you arrived on MIT's campus?
I guess for me, it was how talented everyone was in basically everything. And what upset me so much was that they weren't even arrogant about it, so I couldn't even get angry at them. Like, they could never take a compliment, for example. And for that reason, I think it really kind of pushed me out of my comfort zone. I was just kind of like this antisocial high schooler who had no clue that I'd be going to a school where people were also just incredibly friendly and probably had the warmest faces in the world. And yeah, it really helped me grow. And it was a very humbling experience just all across the board.
Steven, I love it, especially your comment about, it's annoying that they weren't arrogant about it, because how can you get mad? But I love that point. All right, on to some more, not that wasn't fun and serious, some more serious ones. So to Mariana and Steven, each of you, or you each mentioned that you've published your recent research, and a number of our viewers want to know where they can find it. So what journal should they consult for things in your space? And Mariana, I'll start with you, and then we'll go to Steven. Where should they look?
Yeah, thanks for that question. The paper, the study I spoke about tonight was published in a journal called Social Science and Medicine. And so that paper can be found under the title Rising Home Values and COVID-19 Case Rates in Massachusetts.
Great, thank you. And Steven?
Because my exact work, it hasn't been published yet, but keep an eye out for it. it'll be out there soon enough. But feel free, I guess, since this is the age of social media, I will be gladly happy to update everyone at Steven D. Truong.
Perfect. Great. Dan, for you, the Jameel Clinic's work on using machine learning to identify antibiotics to treat drug-resistant bacteria is fascinating. It's one of my favorite examples of just using machine learning AI to solve really interesting problems. Have they applied that know-how to treatments for COVID-19?
Yeah, so that's in general at MIT, early in the COVID pandemic, many parts of the Institute looked at redirecting research toward solutions for COVID-19. And the Jameel Clinic was not alone in that. There's actually a site called aicures.mit.edu, which is run by the Jameel Clinic, that brings together a number of the machine learning research projects that have been done under the auspices of Jameel Clinic, aimed specifically at COVID-19. And in particular, one of those actually was just highlighted in MIT News, I think literally today, which is some work that looks at machine learning approaches to take known drugs that are used for other things and see if they're effective at treating COVID-19, particularly in older patients, where even vaccination may not work as well because they don't get as much of an immune response from the vaccines. And that's where work by Caroline Uhler in the EECS department. So it's something that's been a big focus across the MIT campus. Jameel Clinic's been working hard on it, and there happens to be a result in today's MIT News.
Thanks, Dan. That's great. And I just add to that, I think, you know, the activity on campus when COVID hit, whether it was new ways to discover drugs or coming up with a very inexpensive way to make face shields or an old project from a design lab to do ventilators, people just really turned to this quickly and really had, you know, sort of wonderful impact. And that's part of what MIT does, but it was great to see that. Steven, the next one for you, and then we'll go to one for all of us. An audience member would like to know more about how your work on genetics impact can illuminate how we should design or redesign protocols for various groups. And I hope that made sense to you. Can you comment on that, please?
Yeah, of course. This is kind of exactly what I hope to address maybe in the future that is however many years. Yeah, I think the first and foremost important thing is basically when we think about a study, how representative it is in terms of kind of, and certainly to also focus on the big question of, well, is this going to be relevant for whatever we're trying to predict? Because there's actually been this quite seminal paper published by, I hope I'm pronouncing his name right, John Ioannidis, and he argues that most of scientific research published so far is incorrect or irrelevant. And you know, it goes back to your question of, well, okay, is it because we're designing these studies incorrectly? I mean, a lot of the factors that lead to these incorrect findings come from basically, you know, things such as bias and, you know, and the bias can literally come from anywhere. It could be something as not as innocuous sounding as funding sources or anything like that. And I think really for things like genetics research, what we have to do is we have to ask, well, okay, who are we going to, or how do we kind of get a population of people that are representative of the diseases we're really hoping to tackle?
Yeah, that's great. Thank you, Steven. I think that really it gives us a sense of where things have to go. So I'm going to now put up a question. It says for all speakers, including me, I'm going to use moderator's prerogative, and I may or may not answer it, but it's a great question. What's the role of ethics in each of your areas? And Dan, I'm going to start with you because I know, I mean, it's true for all of us, but the college, that's one of the, to me, the three pillars that the college is built on. But for Mariana and Steven, same question. What's the role of ethics in your areas? Dan, please.
Yeah, so as you said, Eric, in the Schwarzman College of Computing, one of the major focal areas is on social and ethical responsibilities of computing. And I think that it's hard to imagine the degree to which with computing already so intertwined in our daily lives, how much more intertwined it's going to get with advances in AI that are currently happening. And that makes it imperative that we really think about a broad set of social and ethical issues. So ethics itself and issues of morality and so forth are extremely important, but there are, economic issues, political issues, legal issues, issues of inequality that aren't necessarily ethical issues in the sort of narrow sense of ethical. And so, we're really looking at the broad set of questions there around computing. And in particular, the fact that computing is transforming almost every discipline, which means that if we don't think about these social and ethical issues in computing, it's sort of like, it's spreading everywhere. And so if we don't get it right in computing, we're going to have negative impact as other disciplines start to rethink what they do using computing. So it's incredibly important, I think, in every area, but particularly given the role of computing right now, it's something we've made a foundational aspect of the college. And again, I'm just going to keep plugging things here. Next week, there should be something in MIT News talking about a new set of case studies that are coming out from the college and social and ethical responsibilities of computing. That'll be twice annually. And the first set of those will be being announced in the next week or so, with a set of 4 case studies about really applicable problems where you don't have to be a computing expert, you don't have to be an expert in that problem. And those case studies are intended to be used from the undergraduate level on up.
Dan, that's great. And I'm going to add 2 things, and then I want to get to Mariana and Steven. Again, the question is role of ethics. I'm sure you haven't lost the question, but just 2 quick comments, Dan, to add to what you said. One is, my perspective, the college, because of that focus on ethics and social impact, is bringing collaborations which were already in place, but strengthening them just across the institute. Our SHAS faculty are interacting with our Sloan faculty, are interacting with our engineering and science faculty. And as you know well, Dan, one of the goals of the college is to hire some new faculty lines, including many that will be joint. And I know one of the searches underway right now. Do you want to say a word about that search in philosophy, Dan? Just a second.
Yeah, so we have a search in ethics of computing, literally in the technical sense in philosophy of ethics. And it's just been amazing watching that search process and watching the philosophy faculty and the computer science faculty and the AI faculty really come at these problems from a set of different directions, and the kinds of discussions that happen with the job candidates are really amazing. One other thing I might note about our engagement between computer science and AI and philosophy is not just around that search, which is extremely important, but in SERC, as we call it, because everything at MIT gets shortened, SERC for Social and Ethical Responsibilities of Computing. One of the first postdocs in the SERC program, a guy named Milo Phillips Brown, an MIT PhD in philosophy, is just starting a faculty position now at Oxford in philosophy. And so, we're starting to already be recognized as a place that's training great philosophers who also really understand computing in a way that most philosophers don't. And it's something that in the philosophy community is being viewed as more and more important. So it's really just terrific to see this as something that's important in computing and important in the disciplines like philosophy that we're working with.
That's great. And sorry, Mariana and Steven, but I wanted to get to that issue. But Mariana, same question. Role of ethics in your field, and how crucial is it?
Sure. And I appreciate Dan broadening it from ethics technically defined to questions of morals and justice. And so, what I'll say is that my work is motivated by the quest to eliminate health disparities, racial health disparities, and social health disparities, because I think that without justice in health, we cannot expect justice in any other outcome. So the search for the just city, for example, is fruitless if we continue to accept health disparities by geography, by race, by socioeconomic status. And I think that justice in health is a very unique and different. We have sort of our highest calling is to address the issue of health disparities, because health is what's going to underlie our capacity to do anything else we want with our lives, right? So I think that, my work is trying to point to the systems and structures the policies and the plans that are creating unjust, preventable disparities in exposure to health risks and in unjust and unfair and preventable health differences in health outcomes, and then saying, what can we do about that? And do it in a way that is ethical, working hand in hand with communities and having people who are close to the problem help shape the research questions, help shape the way the research is actually operationalized, help make sense of the data, interpret the data, and then tell their own story and put it into action in a way that they would like to use the data. So it really motivates everything that I do, and I really appreciate that question.
Thank you. It's great. Steven, thoughts?
Of course, Mariana, I really appreciate you kind of focusing on the idea of justice. It's kind of something I kind of sleep and dream and think about quite a lot, actually. And yeah, this is something that is obviously very, very important when we think about things like genetics research. I mean, we're already able to predict things within, or predict your height within an inch or so. So think about what you can do in the future when you can predict diseases. I mean, there's perhaps some entities who would love to know kind of your risk for disease, right? I.e., health insurance companies and so on. So then are we going to become, if we're going to coin a term here like genecist, and that obviously is a really deep down dark path. And of course, this is something that is extremely important for healthcare, for scientists, people like myself who want to go into that field. And that's why I think it's now more important than ever, for example, for scientists to also learn how to be good communicators. We've seen so much of a kind of disparity between what scientists are saying and what people are understanding in the public. Just the pandemic in general has really clearly demonstrated that. I mean, that's why, for example, I majored in writing, because I realized, I think early on, that besides my love for stories and movies and whatnot and wanting to write, I understood that, as a scientist, I needed to do more if I wanted to make that science accessible to everyone I hope to kind of reach.
Steven, it's a great point. And by the way, it's why 15 years ago, we changed from a writing requirement to a communication requirement, because we agree with you, you need to do it. I've got some individual questions and we still have a little bit of time left. So Mariana, the next one is for you. The connection with the community where you considered the individual's approaches to healthcare is very interesting. And the question from one of our audience members is, how do you build trust? Does your team also put together approaches for doctors and clinicians to help communities and address individuals' fears and concerns?
Wow, that's a fantastic question. Okay, so I think the short answer is that you build trust by being trustworthy, and you build trust by continually showing up, being transparent, and coming with a posture of kind of horizontal peer relationships where no one person on the team has all the answers, recognizing your own blind spots, acknowledging the truth that other people's experiences hold. And I could go on and on about this, so I will stop that. But I think the key to building trust is by being a trustworthy partner. We're not the experts in how to build trust in a clinical setting. There's a ton of great people doing that work. I can put together some resources. That's not exactly what we do, but it's a wonderful question.
That's perfect, Mariana. Very well said, and I really appreciate that. Dan, I have a great question for you. Not that they all haven't been great questions, but we have a question from a high school senior who has just completed some computational biology research at a local hospital on cancer immunology, and who's inspired by MIT's work in machine learning and AI to develop cures. Are there suggestions you can offer about additional opportunities to pursue things in computational biology at MIT or elsewhere? What advice would you give to a high school senior?
I'm going to start with the very local advice, which is come to MIT and do a UROP. And that's my advice to most MIT undergraduates about the UROP side. But seriously, I think that to me, the really powerful set of questions are at the border of using machine learning in a variety of health areas, both for discovery and for clinical treatments. And in cancer, there's both a lot of research to be doing, but also a lot of clinical opportunities. And so I think that a place where you can, find people who are leading machine learning researchers within AI who are also working on health problems. And at MIT, we do happen to be very strong in that combination of machine learning and health. But there are a number of other institutions, and I would look for, computer scientists working with health professionals, either biology, more translational biology folks, or people in medical schools on practical problems. That to me is really the best combination.
That's a great answer. And I'm sure most of our audience knows this, but for those of you who don't, UROP is Undergraduate Research Opportunities Program, a tremendous program at MIT where undergraduate students work on cutting edge research with faculty, with postdocs, with graduate students. MIT.urop.edu will get you lots more details there. We have a few minutes left. And so I'm going to unfortunately, we're not going to get to all the questions, but there is a question for all of you that I think would be a nice way to try and wrap this up. And so for all of you, how do you think technology can be designed to avoid future outbreaks? Can it? Particularly in genetics, where we don't know what factors might have an impact on the results, and in AI, where we've sometimes have ways of thinking about it, sometimes we don't. But just generally, what role do you think technology could have in trying to prevent future outbreaks? And just because I've been starting with Dan on every one of these, I'm not going to this time. Mariana, I'm going to ask you to start, if you don't mind, just thoughts on this, and then Steven, and then we'll let Dan finish this up.
Sure. I mean, I'm probably the least qualified to answer this question, but I would say that we have to be cognizant of the fact that technological advances, even if on average they improve conditions for people, can also widen disparities. And so I think any technology that is intending to kind of mitigate the fallout from some future crisis or outbreak has to really has to start from the position of sort of the most vulnerable users of that technology, and be developing and designing with those populations in mind, so that even if the technology is great on average, it's not also exacerbating disparities. So I don't have a lot of expertise on this, though.
But Mariana, it's a perfect answer, because it shouldn't just be the technologists answering this question. It needs to be people that think of it from just a whole range of perspectives. So I love your answer. Steven, thoughts? What role, if any, can technology play in trying to prevent future outbreaks?
Mariana, I argue I'm much less qualified to answer this. But yeah, if I had to kind of chime in my thoughts here, I'd say that, if we actually knew how technology would prevent a future outbreak, we'd all be rushing to that field. And it's kind of only a guess from here.
Yeah.
And in the same way that genetics research in a few decades ago, we never would have imagined we would have gotten here. I think that when the next outbreak does come, we will have technology to at least mitigate kind of the fallout. I hope that this past year has been a learning experience for everyone, and everyone has realized that scientists and engineers have a lot to offer, and that it's not some always an ivory tower where we keep kind of mixing solutions until one day a black hole is formed and everyone gets sucked into it. No, it's a lot of very well-meaning and very caring people who really want to make the world a better place. So I just hope that the past year has kind of taught everyone that yes, we do want to help.
Steven, a perfect answer, and thank you for bringing in a better world, because that's where we're all headed for. Dan, thoughts?
Well, actually, I'm humbled by both Mariana and Steven's answers, and I agree. I'm the computing technologist here, but I agree with Eric's observation at the beginning that these are questions that need to be answered very broadly, and not just by technology experts. And that's, again, one of the things that we're looking to do in building partnerships in the Schwarzman College of Computing across MIT broadly, looking at these kinds of questions. I think that one of the really amazing things about machine learning lately in a variety of domains is its ability to look at large data sets and make predictions that experts are unable to do from the same data. And that is by itself a two-edged sword. And you certainly need to think about, when you're gathering lots of data and making predictions, you definitely need to follow what I'll call Mariana's rule of don't just look at the average. You have to look at the outcomes, particularly at the bottom end, and understand what's happening there. But one of the amazing versions of that is breast cancer detection, which now MGH is starting to use some work developed at MIT by Regina Barzilay in their actual clinical practice, because it can detect breast cancer much earlier than radiologists. And I think we have so much data about human behavior that I do think you could start using machine learning to predict behavior changes that might indicate early stages of a pandemic. It's a very exciting area, but one where we have to be very careful with what we're measuring and what we're doing with the data that we're measuring.
And I think this is a great way to bring it all together. And I would just add very quickly, because I'm getting the signal that we need to move on to the next session, but just to make, it strikes me that interdisciplinary is so important here. It is all parts of MIT working together to make this go. And I appreciate all of you with sort of wrapping that up. So thank you to the audience for some great questions, some stimulating questions. Thank you to Mariana, to Steven, and to Dan for some great answers and some great presentations. I know I learned a lot tonight. I'm sure everybody else did as well. To our audience, we hope you'll stay and participate in the next round of breakout sessions, set to begin in just a couple of minutes. To find your next session, just navigate back to the event page and choose the session you would like to attend. Enjoy the rest of your evening, and please stay safe. Thank you.